Hello, my name is Priscilla Posidonio. We're gonna record my physical test for NSG6020.
And I'm Kara, and I consent to this video.
All right, perfect. So first, I'm gonna start introducing myself. Hi, Kara. How are you today?
Hi, I'm good. How are you?
I'm Priscilla. I'm nurse practitioner students. We're gonna do a physical assessment on you. Okay?
Perfect.
All right. Can you tell me your full name?
Kara Merchant,
All right. Your date of birth?
9/16/85.
You know where you are?
I am in the office.
Okay. What day is today?
Today is the 22nd of
All right.
December.
Perfect. So Kara is our oriented times forward, which is gonna be time, situation, person, in place. I'm gonna start washing my hands real quick. All right. You have any medical history? No medical history. You any concerns? Any complaints? No. Okay. I have your vital signs over here. So your blood pressure is 120/80. Your heart rate is 77. Your oxygen level is 100%. Your temperature is 36.5 Celsius. Your height is 5'5", your weight is 60 kilograms, and your BMI is 17, which is all in the normal range. Pretty good. All right. So now I'm gonna start it checking your skin. So I see in your face it's kind of normal, hydrated. I don't see any obvious lesion. I'm gonna touch your head, okay? We're gonna access your head. I can see your head is on the midline, no obvious trauma. I cannot feel any abnormality, any mass, and any tenderness? No? Okay, perfect. So now I'm gonna touch your temporal pulses, which is regular, normal, okay? So now I'm gonna assess your cranial nerve 5, which is the trigeminal. So I'm gonna ask you to open your mouth, close, clench your teeth, your jaw. All right, your TMJ, tenderness, it's normal, no tenderness, perfect. So now I'm gonna access your cranial nerve 7, which is the facial nerve. All right, I'm gonna touch you. You tell me what you feel, if it's dull or sharp. Sharp, dull, dull. All right, perfect. Now I'm gonna ask you to give me a big smile. All right, raise your eyebrow, puff your cheek. All right, perfect. All right. All right, I don't see any abnormality, any deviation, normal. So now I'm gonna access your cranial nerve 2, which is the optic nerve. So we're gonna do the smell and test. I'm gonna get my card, and I'm gonna be 6 feet far from you, okay? I want you to read with both eyes first, the lowest line that you can read.
CFDHJ.
All right, so now close one eye.
CFDHJ.
Now with the other eye.
CFDHJ.
All right, perfect. Okay, your score is 20/20, which is normal for the right, left, and both eyes. All right, so now I'm gonna access your cranial nerve 3, which is the oculomotor, and 2, which is gonna access your pupils. Let me check your sclera real quick. Look it up. All right, sclera is pink, moist. Your conjunctiva is normal, don't see any secretions. Your iris is regular, equal bilaterally. So I'm gonna get my pen line and access your pupil, okay? All right. Perfect, they are equal, both sides, about 3 millimeters. Perfect, so now we're gonna access your cranial nerve 3, which is the oculomotor, 4, which is the trochlear, and 6, which is the abducens. I'm gonna ask you to don't move your head, look at my nose, and I'm gonna follow my finger with your head, with your eyes, okay? All right, perfect, okay. So now I'm gonna access your ears. I'm gonna inspect first to see if we can see any abnormality. I don't see anything. I'm gonna palpate. Any pain over here? No? Okay, perfect, all right. So now I'm gonna access your ear. Before that, we're gonna do a whisper test real quick to make sure you can hear properly, okay? So I'm gonna ask you to close one ear. I'm gonna say some words and you tell me what you hear, okay?
1, 2, 3.
The other one.
4, 5, 6.
All right, perfect. Okay, so now I'm gonna access. I'm gonna hold your peanut up and back. All right, your external auditory canal. I can see your midline, I can see your tympanus, which is pearly gray. I don't see any cerumen, secretion, any redness. Up and back. Same, I don't see cerumen, secretion, your external auditory canal, your internal, and your tympanus are pearly gray. Alright, perfect. Okay, so now we're gonna do the Weber test to check if you have any hearing loss. Okay, so I'm gonna put this on top of your head. You tell me if you're hearing with one ear, another one, or both. Okay, perfect. So now I'm gonna do the running test. So I'm gonna tell me if you can hear properly. I'm gonna touch your mastoid.
Mhm.
Yeah.
Mhm.
Perfect. Okay. All right. All right. So now I'm gonna assess your cranial nerve. I'm gonna access your nose, which I can see that's no obvious fracture. Okay, I don't see any obvious secretions coming out. I'm gonna ask you to take a little bit of back on your head. All right, I don't see any redness. I don't see any septum deviation. Perfect. So now we're gonna access your mouth. I started with your lip, which is moist, normal. I don't see any lesions. I'm gonna ask you to open your mouth. All right. I don't see any obvious fracture, cracks in your teeth. Your gums are pretty normal. Your heart rate is okay. Perfect. So I'm gonna access cranial nerve 9, which is the glossopharyngeal, and 10, which is the vagus. I'm gonna ask you to say ha. Okay, your uvula, I can see that's kind of normal. All right, perfect. So now I'm gonna access your cranial nerve 12, which is the hypoglossal. I'm gonna ask you to stick your tongue out, move side to side, up and down. All right, perfect, no abnormalities. All right, so now I'm gonna start accessing your lymph nodes. I'm gonna touch, okay? So anterior auricular, posterior auricular, occipital, okay, supramandibular, segmental, tonsillar, anterior cervical, posterior cervical, subclavicular, and axillary. All right, perfect. I don't feel any edema and any pain when I touch you. No? Okay. So now I'm gonna access your thyroid. So I'm gonna touch in here. Can you swallow for me? All right, perfect. Okay. So now I'm gonna access your cranial nerve 11, which is your range of motion on your shoulder. So I'm gonna ask you to put your shoulder up. I'm gonna put a pressure here. Perfect. You can relax. All right. All right. So now I'm gonna access your biceps and triceps. I'm gonna move to see the range of motion. So flexion, extension. Perfect. Flexion, extension. Okay. So now I'm gonna ask you to flex. I'm gonna put a pressure, hold me, push. All right, perfect. Okay. So I'm gonna access your range of motion in your shoulder. So I'm gonna do up, perfect. Up. All right, perfect. Okay, so I'm gonna palpate here both radial pulses, regular, brachial. Okay, can you squeeze my hand? All right, strong, good, straight. All right, perfect. Now I'm gonna check your chest. Can you take a deep breath for me? Okay. All right, they're symmetrical. All right, I'm gonna check your heart. I'm gonna listen your heart, okay? Second, intercostal space for the aortic. Second intercostal space on the left side for the pulmonary. Third intercostal space, so the herbs sign. Fourth intercostal space for the tricuspid. Fifth intercostal space mid-clavicular line for the mitral and the apex. All right, perfect, pretty good. I'm gonna palpate your carotid arteries. I'm gonna ask you to hold your breath for a minute. Okay, relax. Okay, perfect. I'm gonna auscultate to see if you don't hear any bruise, any abnormality. I can hold your breath. Okay, we can relax. Okay, I don't hear any bruise, anything at all. All right, so now I'm gonna check your lungs. Okay, so we're gonna auscultate your lungs. I just need you to give some deep breath for me. Take a deep breath. All right, perfect. So now I'm gonna ask you to stand up for me here real quick, just to check your back, your chest, okay? Can you say 99?
99.
One more time.
99. 99.
Okay, perfect. Then I hear your lungs. Deep breath with your mouth open. All right, perfect. You can take a sip. All right, so now we're gonna check your tendon, your flexion, okay? So I'm gonna ask if you're like this, I'm gonna use my comfort. Okay. Perfect. Okay, I'm gonna check your knees as well. I don't see any obvious swelling. We're gonna also check your tendon reflex. Okay, perfect. And I'll do the same here to check our Achilles. Perfect. All right. So now I'm gonna ask you to lie down. We're gonna access your abdomen. Okay. All right. I can see. I don't see any obvious mass, any abnormality. We're gonna auscultate. Check your abdomen, okay? On the 4 quadrants. All right, perfect. Normal sounds. Now I'm gonna check your aortic arteries, which the aortic is gonna be below your umbilical. Also the renal arteries, both your umbilical, femoral. Alright, so now I'm gonna do the Bloomberg test. I'm gonna be 90 degrees with my hand over here in your umbilical area. You tell me if you feel any pain, okay? Any pain? Any pain? Awesome, okay. Everything pretty normal. I'm gonna palpate your liver. Take a deep breath for me. Perfect. Okay, perfect. Check your hips. Palpate your femoral arteries. Awesome. So now we're gonna access your range of motion. Okay, I'm gonna ask you to bend your both knee. No pressure. Awesome. Perfect. Relax this arm just like for me. Awesome. Perfect. All right. So go dorsiflex. Push me. All right. Perfect. Binsky test, which is absent, which is normal. All right, perfect. You're gonna take a seat one more time. Awesome. All right, so now I'm gonna ask you to stand up, looking at me. All right, perfect. You're gonna straight both arms like you're holding a tray. Close your eyes. All right, just to check your balance, which is normal. You can open your eyes. You can walk this way. Normal gait. You can go, turn and go back. Oh, perfect. Okay. I'm gonna ask you to take a seat real quick. I'm gonna give you some objects in your hand. You close your eyes. You tell me what it is. Okay?
Okay.
So you can hold this for me. What is that?
And mine.
Notebook. Perfect. All right. So that's it. So Priscilla Posidonio for South University.